Good morning, everyone, and thank you for being here today. I want to speak directly to Albertans about how the respiratory virus season is unfolding in our province. We continue to monitor influenza A, B, COVID-19, and RSV, and I want to share what we're seeing right now and what Albertans can do to protect themselves and one another. This season, Alberta experienced an exceptionally large wave of influenza A, H3N2. Over the course of December, influenza A activity rose steeply and placed significant pressure on emergency departments, congregate care sites, and care providers across the province. But there's some encouraging news. Early indicators suggest that influenza A activity has reached its peak. We are now seeing test positivity rates decline, case counts are beginning to fall, and the number of Albertans admitted to hospital with influenza A is starting to drop. The most recent public reporting, the week of December 28th to January 3rd, saw decreases across all influenza indicators compared to the prior week. Over the reporting week, test positivity declined from 36% to 29%, and influenza cases have decreased from 2,539 to 1,988. Acute Care Alberta works with acute care providers to monitor daily hospitalizations. Based on their monitoring, we know that hospitalizations for respiratory viruses peaked on December 31st at 995 patients, 700 for influenza, 195 for COVID-19, and 100 patients with RSV. As of today, there are 706 patients in hospital, 513 for influenza, 118 with COVID-19, and 85 for RSV. Hospital admissions may increase slightly as reporting is finalized, but they are not expected to exceed the levels seen during the week of December 21st. This is welcome progress, but it does not mean the season is over or that we should let our guard down. At the same time, we're seeing increases in circulation of influenza B. Influenza B often emerges later in the season, and while these waves tend to be smaller and associated with milder outcomes in immunized Albertans, they can still cause significant illness, especially in those who are not protected. We are watching those trends closely. COVID-19 remains stable and low, which is also promising. RSV activity is beginning to increase, slightly than in typical seasons, when we see it peak in December. Based on historical trends, we expect it may continue to increase until late January. Respiratory virus seasons are always unpredictable, and this year is no exception. Our health system, like others across the country, has been under tremendous strain. Hospital and emergency departments remain busy with patients who are ill with respiratory viruses, along with the usual concerns we see in winter months. Surge protocols are in place and activated when needed, and healthcare teams across the province continue to respond with dedication and expertise. I want to take a moment to thank the healthcare workers who have shouldered the pressures of this season. Their commitment to caring for Albertans has been extraordinary. While we monitor these viruses closely, there are important steps every Albertan can take to reduce the spread of illness and help protect those around them. First and foremost, please stay home when you're not feeling well. This is one of the most effective ways to prevent transmission and protect people who may be more vulnerable to severe outcomes, especially seniors, young children, and those with underlying health conditions. Good hand hygiene always makes a difference. Washing your hands regularly, covering coughs and sneezes, and cleaning high-touch surfaces helps limit the spread of respiratory viruses in our communities. If you're feeling unwell and unsure whether you need urgent care, please call HealthLink at 811 before visiting an emergency department. Many respiratory illnesses can be safely managed at home or with support from primary care. Staying up to date on recommended immunizations remains one of our strongest tools. The influenza vaccine is free for all Albertans 6 months of age and older. COVID-19 and RSV vaccines are also available at no cost to eligible individuals through community pharmacies, public health clinics, and the Alberta vaccine booking system. Even with some mismatch between this year's influenza vaccine, specifically for influenza A, H3N2, the vaccine still offers valuable protection, particularly against severe illness. We continue to see that people who are immunized experience fewer complications and that the vaccine provides meaningful protection for both influenza A strains and influenza B. If you have questions about whether you're eligible for these vaccines or where to access them, please contact your primary care provider, call HealthLink at 811, or visit the Alberta Government website for up-to-date guidance. As always, our approach is grounded in evidence, constant monitoring, and the need to ensure the health system can continue to provide safe and reliable care. We will keep Albertans informed as the season evolves. Thank you. And I'll turn it over to Andrew, who will be moderating today's questions and answer a portion of this availability.
Thank you, everyone. We'll now open it up to questions from the media. As always, if you could please state your name and outlet, and we'll be sticking to one question and one follow-up today. We'll start here in the room. We just have a microphone at the front before moving to the phones. We'll now take our first question.
Hi, Dr. Alana Smith with the Globe and Mail. I have a question for you just about the season as a whole. Obviously, we've seen that we've had, skyrocketing cases. Hospitalizations are way up compared to previous seasons. We also have an immunization coverage of 19% last time I checked. So things are going up where they don't want to go up, and things are going down where they don't want to go down. Can you paint me a picture of basically how we got here? Why is this season so much worse than other seasons? And what hasn't been done that has been done in previous seasons?
Yeah, so influenza is, again, the predominant virus that has been circulating, and influenza seasons always vary every year to a degree. This season, we had an early peak, and it was also predominant strain of influenza A, H3N2. This is typically a strain of influenza that is more severe compared to other strains, and especially for those with chronic conditions, elderly, and the very young. So this is what we've seen in Alberta, and we've seen in other jurisdictions. In the years where influenza A, H3N2 is predominant, those are the years we typically see higher rates of hospitalization as well. So that is a piece that is mainly driving the surge capacity challenge related to the influenza virus. The vaccine, so influenza vaccines every year, there's some tweaks to that. The influenza A, H3N2 component is usually the lower effective part of the vaccine every year. This year, there's also a slight change of the virus compared to the vaccine, so it's a different subclade. Having said that, the vaccine has less effectiveness for H3N2, but it is still protective and helps decrease hospitalization rates and severe complications. In fact, 74% of hospitalized cases of influenza, both in the kids and the elderly and all demographic, have not been immunized this year.
So I'm hoping you can, one, just speak a little bit to why you think immunization rates are lower this year, especially among children or vulnerable populations. But in addition to that, I know Acute Care Alberta last night, they had mentioned, they're dedicating 336 beds for respiratory virus season. They're opening designated surge spaces. You're talking to us now when the height of it, which was in December, is over. There's this question of why now? Should this work not have been done over the last month?
Okay, so there's two questions there.
Yes.
So the one is influenza immunization rates. So we've seen decreasing rates in adults and children already, even almost prior to COVID, but specifically post-COVID as well. So this is a trend that is happening for not just influenza vaccine, but other vaccines. Why now? So again, the season is a little different than other seasons for the reasons I noted earlier. There is a lot of planning that goes on to prepare for respiratory virus season. We usually call that season beginning of October to the end of March. By May, June, there's already planning in place. So supporting congregate care, supportive living sites, for example, making sure that there are individuals who can immunize, that's supported, that outbreak management, there's awareness, education, et cetera, because if influenza ends up in facilities, but that it can be identified quickly and managed quickly so we don't see transmission within all our congregate care. So these are examples of activities that happen throughout the summer and even earlier. So there's a lot of supports in place to try to prevent this surge for acute care. And then within acute care and across all health providers, there are plans on how to coordinate care to make sure that there is that capacity within acute care.
Sorry, just a point of clarification, then I promise I'll leave. But are you saying that not enough planning was done, and that's why we got hit so hard, or could more have been done before we got to this?
No, I did not say that not enough planning was done. I'm saying there's a lot of planning that happens every year in order to prepare for influenza season. And there's plans in place and surge capacity plans in place within the acute care system, but within all health systems.
Hey, Tim Brooks, CTV. Further then to that answer, hindsight's 2020. What could have been done differently? What should have been done differently so our system's not so overwhelmed right now?
Well, every year we learn from previous years. So again, even looking at vaccine predictions and matches, et cetera. So there's big pieces like that. There's also learnings on delivery of immunization, on delivery of messaging, of access, and also of planning ahead as far as which strain would be. Difficult to predict a year ahead which predominant strain is going to be there, and it's cyclical. So there's always sort of these quality improvement initiatives and learnings, and working with all partners to coordinate care to ensure that everybody's getting the right care at the right place and that there's capacity within acute care. This season, as I said earlier, is very unique. We have a very high, quick peak and a high peak of influenza A, H3N2, and that is a unique strain that is also slightly different than what was predicted to come.
You mentioned immunization there and messaging around immunization. So as we head into the next flu season, next winter, do you think that the messaging around immunization needs to be stronger here in Alberta to ensure that we're not seeing the peak that we saw this year?
So there's a lot of messaging happening at different levels, and I think as Albertans, we all have a responsibility to protect our loved ones and our communities. The messaging is very similar year to year, and even messaging within, let's say, seniors care, right? There's messaging that happens within facilities. So there's messaging happening from all levels. It shouldn't just be happening from sort of one entity, if that makes sense.
From the provincial level, though, could the messaging have been stronger?
There has been messaging all along. I think even prior to release of the vaccine and then throughout, as far as messaging around what is the vaccine, who's eligible, where to access, et cetera.
Okay, thanks.
I'm just wondering if, Sarah Hoffman, Global News, I'm wondering if you're able to describe some of the severity that we're seeing in, influenza A and influenza B. I heard some people talking about paralysis of their legs. Is that something that you've been hearing about? Can you talk about some of the more severe symptoms that you're seeing?
Yeah, influenza. So we'll talk about influenza in itself. It's an interesting virus and sort of the inflammatory response in humans. Often when people need admission, they may be requiring admission for infection of the virus itself, but more typically, it's for complications of influenza. So they've had influenza, they may have pneumonia or other sort of bacterial secondary infections. But we also see a correlation every year during influenza season of impact on the cardiovascular system. So we have a higher rate of stroke, heart attack, and congestive heart failure with individuals who've had influenza. And so there is a protective factor of the immunization, not only for influenza, but some of these very severe complications. There are multitudes of complications that can happen, and sometimes viruses can cause neurological problems as well. So if you're speaking about paralysis, that could be a very rare complication of influenza as well.
I'm also just wondering if you can just touch on the immunization campaign from the perspective of the changes that were rolled out this year. That we had some people that were complaining that, they couldn't get into AHS clinics with their kids as they previously had been able to book, their entire family there, and just the changes in how it rolled out that perhaps could have created some barriers for some people, as well as commenting on whether, if people saw those barriers and didn't get immunized, is it still useful for them to go back and do that now?
Yeah, so access to vaccine, always trying to make sure that I know that Primary Care Alberta and pharmacies and others are very much spearheading that. So the access can be a challenge. I think there's always, by having influenza vaccine in pharmacies as well for kids 5 and over, that there is access also during times when public health isn't open, for example. So challenges with capacity and delivery of vaccine. So the family issue, I know, was noted. So instead of the whole family coming in, getting everything in public health, there were some changes in that delivery with COVID also being delivered through public health this year. So some adjustments were made. But there are still many points of access that individuals can utilize. Healthcare workers, I know within Alberta Health Services and other acute care providers, there was also through workplace health and safety on the sites as well. That also is not for families, that would be for the healthcare providers.
Hi, Laurence with Radio Canada. Frontline workers were asking for the province to declare a state of emergency. Now we're past the biggest peak of it, it seems like, but I'm wondering why that wasn't done, or what does it take to declare a state of emergency where we've heard about people's, emergency being overcrowded and people waiting for hours and, yeah.
Yeah, so I think I'll just make one other point and then I'll get into your question there. Sometimes we see, and in the data, we'll see the positivity rates of influenza or another respiratory virus peak. Then we see calls to HealthLink, and then slowly we see admissions to hospital. So that admission, and then especially complications of a severe virus like influenza, can be delayed. So if our peak, the acute care emergency peak may be a little bit later, but not very long afterwards, but a few days later. So yesterday there was also an announcement from a media statement from Acute Care Alberta outlining the multitudes of strategies within the health system that are have been implemented to address the acute care challenges as well as the emergency department. A public health emergency is different than that's under the Public Health Act, Section 51. It's different than a state of emergency. So those are two different things. To declare a state of public health emergency is a significant decision, and it grants the government basically authority to ensure collaboration of all aspects of delivery of care and not delivery of care, sorry. It ensures collaboration of all partners to protect the public. So this could be schools, businesses, etc., to coordinate to protect whatever the emergency is. That may mean compliance with orders. It does not change the authority or the ability of the government to address operational matters within and between health service providers, if that makes sense.
Yep. And you mentioned also, every year you're learning and a bit about the planning process. I'm wondering what lessons you'll carry on onto next year from what happened during this peak in December.
Yeah, so there's many levels. Some are sort of Alberta level, some are national and international, looking at what strains are circulating, what are we predicting for circulation next year, what are the seasons for Southern Hemisphere, Northern Hemisphere, et cetera. So those are pieces that happen. We also look at vaccine effectiveness data, so that is done at looking at hospitalization data, immunization data, and looking at that. That comes usually January, February, we hear about that. So those are aspects that are utilized for immunization. And then there's ongoing surveillance thereof. So if we see there is early predictors that in other jurisdictions in Europe, for example, there was a high wave of influenza and it was H3N2 and there was slight nuances from the vaccine. And so there was that projection happening in sort of the late fall that we heard about. So those are pieces. As far as within Alberta, the coordination of care, that tweaking happens all the time. As far as, and as you heard in the statement, and I believe at the end of this week, Acute Care Alberta will also provide an update around all the activities that are happening in order to ensure that there's enough beds, et cetera, for the acute care piece and when people move back into the community. Within vaccine delivery, for example, we tweak those pieces as well. There is the new Alberta vaccine registry. It was piloted in the fall, that you could reserve, or that you say you're interested in, let's say, COVID vaccine, to hopefully down the road predict how much vaccine a province should purchase, so we don't have wastage of vaccine. So those pieces there's many, many moving pieces. Working with continuing care facilities, if a pharmacy delivers vaccine there, is there ways to improve that? Do we need to have other providers as well? So there's so many moving pieces to ensure that individuals have the right information for the decisions that are right for them and for the community that they're part of, let's say, in continuing care.
Just make a quick follow-up just to make sure I understand.
Yeah.
Are you saying that maybe there will be some revisiting of the fact that you need to pre-book your vaccine, and those are sort of the things that will be planned for next year?
Yeah, so that is piece that is looking at, because that was sort of a pilot to see if that would assist in looking at how much vaccine would be needed to be procured, so there's not wastage. So that was something that was tried, and see how that works, and if we can utilize that tool to better predict for certain vaccines. Because every year even there's how much vaccine, what is the percentage of population that is expected to request influenza vaccine, for example. So those are the doses that are then procured well in advance, because they're purchased at a federal level.
Can I just ask you a quick question?
Sorry, we're going to go to the next reporter in line here.
I'm Felix from Radio Canada. You mentioned the acute care peak being following the influenza peak. So when do you expect hospitals to be relieved from the peak?
That's difficult to predict, especially when so when you look at the data of even calls to HealthLink and then visits to emergency departments, you can follow that, and it's not very long, it's days. So you see school absenteeism first reported, and then you will see calls to HealthLink, and then you will see visits to emergency departments, and then admissions. So, but they follow depending on which virus. You can see that syndromic surveillance happening. Influenza, because of the many complications of influenza, some people, if they've had a heart attack, they may need to be in hospital for quite some time, right? And so it's difficult to predict, but it doesn't follow very long. I can't say it's 1 or 2 weeks, but it's quite short.
All right. And last year there was an higher peak in the late February and early March, and 2023-2024 season also had a secondary peak that was lower in February and March too. Following what you said earlier about influenza B and stuff, is a secondary peak to be expected this season too?
So most seasons, there is a smaller influenza B wave. And then, of course, every wave has a peak. It's usually not as drastic, at least in the 17 years I've been in this work. It is not this drastic peak that we see with influenza. So it's slower, it's usually less severe, and it impacts seniors less. So the influenza A, H3N2 is most significant for people who are senior and those with underlying conditions.
Is it because it's more viral, the H3N2?
They actually act differently. So we've got different types of influenza. We even have bird flus, right? There's so many different types of influenza around. So the influenza Bs are cause milder illness, especially for those who are immunized. And the vaccine is also a better match. And interestingly enough, we have a trivalent vaccine this year instead of quadrivalent vaccine. And one B component, the Yamagata component, was actually is not part of the influenza vaccine this year because it hasn't been seen since March 2020. it stopped circulating, which is interesting.
All right. Thank you very much.
Okay.
All right, we're going to move to the phones. Operator, can you put through the first caller, please?
Your first question comes from the line of Connor Hobb from CTV News. Please go ahead.
Hey, I'm just curious if the long wait times that are being reported in hospitals currently by doctors calling for the state of emergency, why are we seeing documentation from AHS that, many hospitals in major metropolitan areas have been operating at over 100% capacity since at least August?
Yeah, so I believe that's probably a question that better goes to later this week to Acute Care Alberta when they're providing updates.
Do you have a follow-up question?
I suppose my follow-up would be, why is, with all of, over a week of reporting of, doctors calling for some sort of, government action, why is there no ministers from the government there with you today?
So I'm not sure I quite understood the question, but I know there was a release yesterday from Acute Care Alberta outlining the current concerns and challenges within acute care and emergency departments, as well as the number of strategies that have been implemented, and then the collaboration with all the other healthcare providers.
Operator, can you put through the next caller, please?
Next question is from Sean Amato from City News. Please go ahead.
Hi there. Just want to confirm, because there's a lot of information flying around. So you're saying the worst of flu season is likely over in Alberta. We peaked at nearly 1,000 patients, but those have now fallen to 700. So unless something crazy happens, we're probably through the worst of it?
That is hopefully the good news, indeed.
Okay, I guess my follow-up is, alluding to what Connor was asking about, I've seen internal AHS documents going back years that says that Alberta is already, Edmonton is already short hundreds of beds, hospital beds. That's in the documents from AHS. They know that this is the case. So I guess the question that I have for you is, do you feel like in some respects you're being set up to fail here because heading into flu season that the system is already taxed or overtaxed on a good day?
Yeah, so I'll let acute care address some of the specific questions around acute care capacity. It's a good reminder, though, of all Albertans and healthcare providers around prevention strategies. 74% of hospitalized cases of all age groups, and most especially the young and the elderly, have not had vaccine this year. So again, if we can all protect each other, stay home when you're sick, etc., wash hands, those preventive messages I shared, that would help the emergency departments. As well, if you are calling HealthLink to assist with initial assessment and or appropriate triage for other conditions as well. So not everybody needs to go to an emergency department when it is already so busy.
We've got time for one more caller. Operator, can you put through the last caller, please?
Your last question comes from the line of Sarah Arena from CBC News. Please go ahead.
Hello. I was just curious, you mentioned obviously we are now past the peak for influenza, and I know that then RSV sort of peaks after that, typically, as you mentioned, later into January. Are you anticipating that to be standard in terms of what we've seen in the past, or do we think that that peak is going to be worse or better than what we've seen in previous years?
Yeah, that is an excellent question. Usually the RSV, we see more hospitalizations in the little ones, the little kids, and then we see some in the elderly. So also post-COVID, which was just an interesting fact I'll share, we saw quite high rates of RSV, and probably because these little ones hadn't seen the disease, hadn't seen the infection, and then got sick post-COVID when other public health measures were lifted. So there's no indication at this time that I'm aware of that the RSV peak is going to be any different than previous years, if that responds to your question. And COVID, Just to add, out of interest, it hasn't really established seasonality. It's just sort of grumbling along, which is interesting.
Perfect. And then I guess maybe just one other question. I know that doctors previously were commenting on just how many people were heading into emergency rooms and that beds were being taken up by people who didn't necessarily need to be in hospital, but they kind of had nowhere else to go. People like vulnerable populations, people who are homeless, who were sick, but not sick enough to be in hospital, but kind of too sick to just release back onto the street. I'm just sort of curious if with surge beds and planning for the future, if there is any component of that for the province to look at sort of what to do with vulnerable populations as they do kind of appear to be taking up some beds in hospital for lack of other spaces.
Yeah, so again, I'll let acute care also address that specific question. But of course, as you pointed out, this requires all health providers and community providers to work together. I personally know that even in the area where I was working prior to this position, there is a lot of work, even from a public health perspective, with our vulnerable unhoused populations, as one example. Partnering with immunization and other strategies is one example. Outreach. So often in our unhoused populations, there are outreach that happens to our shelter population, for example, at a variety of shelters early, right when the vaccine is out. So there are strategies also supporting if there's individuals that are ill. How can we support? We have outreach workers or nurse practitioners who can also support in the community.
All right, folks, that's all the time we have for today. Thanks so much.
Thank you.
One more, Doctor, if you don't mind. I'm just curious.
Sorry, that's all the time we have for today. Sorry, if you have additional questions, you can just reach out to us directly. Thanks.